Hey everyone, and welcome back to the channel. Today, we're diving into a really important topic that affects millions, often silently: fatty liver disease. Are you experiencing vague discomforts you just can't seem to figure out? It might be more than just stress or tiredness. We're going to uncover 10 fatty liver symptoms that your body might be sending you as warning signs. Some of these are surprisingly common, while others are less known but crucial to recognize. Stick with me, because understanding these could be the first step towards protecting your liver health. Let's get started. 1. Persistent fatigue. This isn't just feeling tired after a long day. We're talking about a deep, ongoing exhaustion that doesn't really get better, even with sleep. Think of your liver like your body's energy plant. When it's struggling under extra fat, it can't perform its hundreds of vital jobs efficiently, including managing your energy levels. This metabolic slowdown can leave you feeling drained, sluggish, and lacking your usual energy or drive, even when you haven't overdone it. It's a subtle sign, easy to dismiss, but often one of the earliest indicators that your liver needs some attention. 2. Discomfort or pain in the upper right abdomen. Have you felt a dull ache, a feeling of fullness, or maybe even sharp discomfort right below your right rib cage? That's where your liver is located. When fat builds up, the liver can get bigger and inflamed. This swelling stretches the sensitive covering around the organ, leading to that noticeable discomfort. It might come and go, or maybe feel worse after eating a large or fatty meal. Don't just write it off as indigestion. It could be your liver physically signaling that it's under stress and needs help. Pay attention to this specific spot. 3. Unexplained weight loss or loss of appetite. Now, this might seem backward, especially since fatty liver is often linked with being overweight. However, as the condition gets worse and inflammation increases, it can mess with your body's metabolism and digestion. This interference can sometimes lead to a reduced appetite. You might feel full quickly, or just lose interest in food. Because of this, you might start losing weight without actually trying. While weight loss is often seen as a good thing, unexplained weight loss, especially when paired with other symptoms, should definitely be looked into, as it could point to an underlying issue like advancing liver problems. 4. Yellowing of the skin and eyes, jaundice. This is one of the more serious signs and usually indicates a more significant liver issue. Jaundice happens when the liver isn't properly processing bilirubin, a yellow substance made when red blood cells break down. Normally, the liver handles and gets rid of bilirubin, but when the liver is damaged or severely affected by fat and inflammation, bilirubin can build up in your blood, causing that telltale yellowish tint to your skin and the whites of your eyes. If you notice this, it's really important to see a doctor quickly, as it signals your liver isn't working right. 5. Abdominal swelling. This isn't just regular bloating after eating too much. Ascites means fluid is building up in your belly area, the abdominal cavity. In advanced stages of liver disease, including severe fatty liver moving towards cirrhosis, the liver's ability to make proteins like albumin goes down, and pressure within the blood vessels around the liver can go up. This combination causes fluid to leak out and collect in the abdomen, leading to noticeable swelling, a tight feeling, and sometimes even shortness of breath because of pressure on your diaphragm. This is a serious sign that requires immediate medical attention. If you're finding this video helpful, please give it a thumbs up and consider subscribing for more health insights. It really helps the channel reach more people who might need this information. Now, let's get back to the symptoms. The next one is pretty. 6. Spider angiomas. Have you noticed tiny red spiderweb-like patterns appearing on your skin, especially on your chest, shoulders, face, or arms? These are called spider angiomas. They happen when small blood vessels near the skin's surface widen or dilate. While they can sometimes show up for other reasons, they are often linked with liver disease. The exact connection isn't totally clear, but is thought to involve changes in hormone levels, particularly estrogen, which the liver normally helps keep in balance. Finding one or two might not be a big deal, but seeing multiple spider angiomas appear could be a subtle clue from your body. 7. Confusion, drowsiness, or slurred speech. This is another serious symptom, usually seen in more advanced liver disease. When the liver is severely damaged, it can no longer effectively remove toxins, like ammonia, from the blood. Ammonia is produced when your body digests protein. As these toxins build up, they can travel to the brain and impact how it works. This can show up as confusion, trouble concentrating, personality changes, extreme drowsiness, forgetfulness, bad judgment, and even slurred speech. It's a brain complication called hepatic encephalopathy, and it needs urgent medical evaluation because it signals major liver failure. 8. Red palms. Take a look at the palms of your hands. Do they look unusually red, especially the fleshy parts at the base of your thumb and little finger? This condition is called palmar erythema. Like spider angiomas, the exact cause isn't perfectly understood, but is believed to be related to changes in hormone processing due to poor liver function, possibly causing blood vessels in the hands to widen. While it's not only caused by liver disease, it can happen in pregnancy or with other conditions. Persistent redness in these specific areas, especially along with other symptoms, can be another piece of the puzzle. 9. Swelling in the legs and ankles, edema. Similar to the belly swelling, ascites, we talked about, fluid buildup can also happen in your lower body. This occurs for related reasons. When a damaged liver has trouble making enough albumin, a protein needed to keep fluid inside your blood vessels, fluid can leak out into nearby tissues. Gravity tends to pull this extra fluid downward, causing noticeable swelling, called edema, in the legs, ankles, and feet. You might notice your shoes feeling tight, or that pressing on the swollen area leaves a dent. It's another sign of poor liver function. 10. Easy bruising or bleeding. Does it seem like you bruise really easily lately? Or maybe small cuts take longer than usual to stop bleeding? Your liver is essential for making proteins needed for your blood to clot properly. When liver function is reduced due to conditions like fatty liver disease, it might not produce enough of these vital clotting factors. This shortage means your blood doesn't clot as well as it should, leading to easy bruising from minor bumps, nosebleeds that are hard to control, or bleeding longer than expected from small injuries. It's a subtle but important sign of how liver health affects your entire system. So there you have it, 10 fatty liver symptoms that range from subtle feelings to more serious signs. The main point here is that fatty liver disease often starts quietly. Recognizing these potential signs early is so important because in many cases, lifestyle changes can help manage or even reverse the condition, especially when caught early. If any of these symptoms sound like what you're experiencing, please make an appointment with your doctor or healthcare provider to discuss your concerns, get the right tests done, and receive advice tailored to you. Your liver is incredibly tough, but it needs your help to stay healthy. Thanks so much for watching. Take care of yourselves, and I'll see you in the